Welcome back to my channel, or welcome to my channel, whichever. I came to speak directly to nursing students who are preparing to take NCLEX-RN or PN. PN might help. I've never been an LPN, but I am currently an RN. I passed NCLEX-RN in 2022 in 75 questions, and I really hate the whole 75 question thing because that causes extreme anxiety. If you get above 75 questions, that does not mean you fail. That does not mean you pass. That just means that you have reached the minimum amount of questions that you have to answer during the NCLEX exam. Okay? So that was one of the things that definitely caused me a lot of anxiety, and I had to begin to coach myself to say or to believe that 75 questions wasn't the end all for me. So if you are one of those people who is worried about 75 questions, please, please, please try not to let that increase your anxiety, because you have bigger fish to fry, sweetie. Okay, so in this video, I'm going to talk about some of the products that I've used. I'm gonna give a quick review on them. Some things that people thought were like great, like, oh my gosh, if you use this, you're guaranteed to pass. They weren't so great for me. So during preparing for NCLEX, it's all about finding out what works for you and sticking to that. And also, people have told me that, oh, well, if you use too many sources, it's not a good idea to use too many sources. You won't have a good outcome if you just use too many sources. It's going to increase your anxiety. And that wasn't the case for me. Like, I used everything that I thought was necessary for me to pass, because when I sat down in the testing center, it was me and that computer. So when I went to test, I made sure that I knew everything that I was supposed to know, and I used whatever sources I needed to use to get the content to stick, okay? So the first thing that I'm going to talk about is some of the things that I used. So I did the Hurst review. The Hurst student manual. Yep, I did the Hurst review. I didn't do the in-person Hurst review. I did the online Hurst review, where it's kind of like live. You have a live person talking to you. You can't verbally ask questions. You have to chat. And it's basically like you're in a group, a Zoom meeting with all these different people from all over, students. And you have this live person, and she is live, because if you type something in the chat, she is going to answer you like I'm talking to you right now. She's going to say, okay, Sarah, yes, this was your question. This is the answer. Or she's going to explain something better to you. So that was very helpful. And, you know, with COVID and everything being shut down, that actually worked better for me, because I was able to, you know, ask questions if I needed to, no distractions. I was in the comfort of my own home. We did get breaks. It was very cool. However, after going through Hurst, doing the reviews, I did everything that Hurst has outlined. Mind you, Hurst is about $300, maybe $400. I don't remember how much it was. I think it was $399. But I went through Hurst, and there were some helpful tips. But after taking NCLEX and using additional sources, Hurst really didn't help me. Hurst is great for some people. It is amazing. It is the only thing that some people feel they need to pass NCLEX. I personally did not get much out of Hurst. And it could have just been me, could have been the way that I learned. But the instructor was phenomenal. She was a great instructor. She gave us specific instructions. She showed up every day. She went hard every day. But Hurst did not work for me. I think for me, the whole fill in the blank was not a good tool for me. Like, when I did Hurst, I was too busy filling in the blanks and trying to keep up that I wasn't retaining anything. Like it was more of just like, okay, you're on here to fill in the blanks. So I'm gonna show you one of my pages. Please excuse my handwriting because I was filling in the blanks that fast. Okay, so sorry that I don't have like all these other little notes on or whatever. So like you see, like it was just like, if you can see, I had to fill in the blanks. And on some of the pages, like if someone stopped and asked the questions, or asked a question, if someone stopped and asked a question and it was relevant to the things that I kind of needed to know, I would just write me like a little note on the side. So yeah, that was Hurst. It wasn't a complete total waste of money because I did learn something, but I wouldn't, if I had to do this all over again, I wouldn't recommend this for myself because of the price and how it wasn't sticking with me. Like I didn't like the way that it was done. So yeah, Hurst is cool. If you feel you want to try it, then try it. But it didn't really help me. So that's Hurst. Next, some of the things that I'm going to talk to you about, I don't have a book for it. So I'm just going to tell you about it. Next thing I'm going to talk about is this Saunders book. I think everybody who is taking NCLEX-RN or PN knows about this book, have seen this book. If you have never seen this book before, you need to see this book, okay? So Saunders was a part of one of the textbooks in our curriculum at my nursing school. So I already had the book. This book is pretty good. I didn't go through every chapter. Like I went through every chapter this past summer because I had a huge exam that I had to pass, mandatory pass. So this summer I went through every chapter. So I already had like a good foundation. However, as related to NCLEX, this book is a good book to go to if you come across a question and you read the rationale. You get the question right or wrong and you read the rationale and you still don't understand. You're just like, you know what? ABGs are not sticking with me. Like, they're just not sticking with me. Like, you have more questions as to why. Because when you are studying for NCLEX, you don't have an instructor. At this point, if you made it to where you're studying for NCLEX, you are supposed to know how to study. Period. And if you don't know how to study, you need to put all this stuff up and you need to go back to the drawing boards and come up with a way that works for you to help you study. So, Saunders. I use Saunders mainly for stuff like that, like content that wasn't sticking, content that I didn't understand, because sometimes when you don't understand something or you keep getting something wrong, it's because you lack the basics of the concept. So, if you feel like you don't want to go to Saunders for that, I highly recommend breezing through Foundations of Care, because in this book, Foundations of Care is basic nursing, and on NCLEX, they expect you to know basic nursing because NCLEX is a safety exam, and in order to pass, they want to make sure that you're going to be a safe nurse. So, let's see, Foundations of Care. Also, in this book, there's these sections that on almost every page. I'm sorry, I'm stuttering because I just got to let y'all know this. So, like in this book, you see that red area? You see the red? Yes. Okay. There's red highlighted words at the end of each section, or like throughout each section. If you're going through Foundations of Care, those red areas you need to lay eyes on, because that is very important information. Like, that's pulling like the most important thing, the take home, in that section that you're supposed to know. And the red areas is not things that just like, oh, well, this might be good to know. This is stuff that every nurse knows. Everybody should know. Are you going to know everything? No, you're not going to know everything. Because when I took NCLEX, there were questions that I got to them and I was like, I don't know that. I really don't know that. But I got something for that. When you don't know anything, Saunders has the first, maybe the first, second, or third chapter in this book is test taking skills. And if you can learn good test taking skills, if you can learn how to pick those keywords out the question, or if you learn to look at answer choices and eliminate all of the like choices and stuff like that, you can answer a question without knowing anything about the principle. So, test taking skills and content and foundations of care. Like, thank you. This is Saunders. They probably got a new edition out. I'm not sure, but this book was like very, very good for me. Also, there's a complex care chapter all the way in like the last chapter. That's a good chapter to look over as well. But like I said, like you don't have to get deep with a pen and a highlighter and read and read and read. Like, no, I feel like that's unnecessary. I feel like there is some things in this book that you just have to know. And if you breeze through this book and you don't know some of this stuff, or some of this stuff looks like, oh, I've never seen that before, you probably need to sit down with a pen and a highlighter and get through those chapters that I previously talked about. So next, I'm going to talk about, so Hurst, don't really recommend. Saunders, definitely recommend for your weaknesses. Okay, Archer. I used Archer. Archer is a program just like all those other programs, UWorld, Hurst, like they have these different exams. I really got a lot out of Archer, and I didn't do like a review program. I just paid like, I think it was like $25 or maybe $30. It was extremely cheap. But Archer has readiness exams, and they tell you like if you're ready or not. Like they'll say, okay, you have a low chance of passing, high chance of passing, very high chance of passing. Like they have these different categories. So I love that because it was number one, it was a confidence booster. Number one. And number two, like Archer also tells you like if you had an answer choice that you clicked on that was correct and you second guess yourself, you change it to a wrong answer. Like they tell you if you changed it from a right answer to a wrong answer, or a wrong answer to a right answer, or a wrong to a wrong. Like they go that deep with you. They also they do these readiness exams. They also do what's called CAT exams, which is like just like NCLEX, computer adaptive. So it is going to spit out an exam, and it's going to spit out questions based off of your knowledge in your last answer, which is freaking amazing. Like, it's amazing. That's all I can say. The screen looks exactly like the NCLEX screen. So does Hurst, and so does UWorld. I mean, I get it, but it was amazing because it was like the realest that I got to the real NCLEX. And it was only $25 to $28, something like that. But it was very cheap. And I didn't hear too much about Archer. Sorry, I can't talk. I got so much information to tell y'all because I was looking for someone to tell me all this stuff. And there's all these videos out, but like nobody's like getting straight to the nitty gritty. So anyway, Archer was amazing. And with the computer adaptive test, the CAT, when you get, like, it's going to cut off whenever you have passed or failed, just like NCLEX. So it can cut off at 75. It can cut off at 145. It's just going to take you until you have accomplished or not accomplished the expectation or the algorithm to pass. So that is 100%. I 100% recommend that. Do I get any money back from any of these places or these people? No. I'm giving back to students in my profession because that's just what we do. So anywho, Archer, yes. UWorld, I did sign up for UWorld. I did questions in UWorld. UWorld was cool. The questions were very lengthy in UWorld. But some people swear by it. So like I said, you have to find out what works for you. And most of us, I won't speak for everybody because that's just wrong, generalizing. But we don't have all this money to spend on all these programs. We just don't. And back to Hurst, I do want to put out there that Hurst gives you 4 readiness exams. And they tell you that if you score over 77% on the exams, you're ready to take NCLEX. You're most likely going to pass NCLEX. So, and they also offer like question banks and stuff like that. So I didn't want to leave that out about Hurst because I don't want to because I didn't like Hurst, I didn't want to not give you all the information. So one thing about the Hurst questions that I find is that the Hurst questions, like if you memorize the Hurst book that I showed you, you're going to answer almost every question right because their questions is based off of the content in their books. And NCLEX is not based off of Hurst's book. You know what I'm saying? Okay. So, next I'm going to talk about, I'm not going to pull all over this pull first. This thing called 37 pages, 35 pages. Like if you go on Google and you Google NCLEX 37 pages or NCLEX 35 pages, like I wish I had the exact number, but I don't. But you get the picture. It's these, I don't even know who created this document, and it's just floating around the internet. So why not use it? And like I went through it, I fact checked a lot of it, and like none of it is like inaccurate information. So these pages like basically give you like a quick, I'll show you one of them. It gives you like a quick little it gives you like a quick little rundown on stuff that you're just supposed to know. So I highly recommend that you look over these 37 to 35 pages like 2 to 1 day before your test. I would say 2. Just in case you look at them and you freak out. You have a little time to fight. But I looked at these pages the day before my test. I went through them with a pen and a highlighter. I looked at them the day of my test, and I looked at them in the parking lot before I went into my exam. And people love to say, oh, well, it's not a good idea to do anything the day before your test. Go sit and go watch a movie. Go relax. That's for the birds. Because this test, no, I don't recommend it. I recommend that you do everything that you can. So when you walk out of that test, whether you're feeling happy or you're feeling defeated, you at least walking out there knowing that you know what? I did the best I can. I did everything that I can. You don't want to walk out the test feeling defeated and you say, oh man, I really shouldn't have went to the movies yesterday and like lived my best life. No, you're going to better live your best life after this is over. So you have to go down fighting. All right. So that is the 13th page. Let's see. And I also like made my own notes, like based off of all the things that I did use, all the sources. I started a list, and it's like 1 page. It wasn't like overwhelming. It was 1 page, and I started writing down the common topics that were popping up, like Addison's disease, Cushing's, Addison's versus Cushing's, SIADH versus DI, stuff like that. So I just started like coming up with like stuff that I always see repeatedly, even in questions on these different question banks, because I felt like, you know what, maybe this is continuously popping up because I probably need to know this and I need to be able to speak to it and ask questions, and answer questions about it. because I learned that it's not about memorizing things for this test. Like, it's about knowing the concept. Like, if you know how Cushing's work or Addison's work, you can answer any question about it. But if you try to memorize the signs and symptoms, like, your brain is not, it's not going to go back to that memory during this test. Like, the anxiety and stress is just going to be too high. The last thing that I want to say, and I really hope that you are still watching this video. I know this video is long as hell. I know this video is long, but I hope that you're still watching this video, because now I'm going to tell you about the source that if I had to pick one source to use, if I had to pick one program or whatever, if I had to pick one thing to use for this test, I 110% recommend listening to the MK files. Mark Klimek's files. Mark Klimek's files. MK files. Google it. Look it up. Look it up on YouTube. Ask your friend. Tell your friends. I highly recommend that. Like, it's that deep for me. Like, it's that serious for me. He has 12 videos that, it's floating around everywhere. It's all on YouTube. He has 12 videos. 12 videos. Watch every second of them. This man, I don't even know that man. I don't really don't know nothing about him. All I know is he's a nurse, and he has his videos floating around. And it's free. Well, it's floating around. It was free. But anyway, if you listen to this man, just listen to him. Seriously. Take time out. Listen to him. Do you have to write like all these crazy notes of what he's talking about? No, because we've just been through nursing school. So we understand the things that he's talking about. Like, we just went through whatever vigorous program that you were in. We understand. So when he's talking about certain things, it shouldn't be new to us. It's just a review. But the key with him is he teaches you how to utilize your knowledge to pass the NCLEX exam. Now, did everybody pass that probably listen to MK files? Probably not, because it's about you. But he's so real about it. Like, he's so real. I guess all I can say, and all I can do is tell you about these files. That's all I could do. Now, it's up to you if you go listen to them. But if I had to use one source, I would use Mark Klimek's files. Yes. He's unmatched at this point. All these different programs, he's unmatched. And overall, I would get a Q bank like Archer that's cheap but very effective. I will listen to Mark Klimek's files. I will review the Saunders book for things that I don't understand, because you don't have a teacher or professor or anything like that at your disposal. Most of us don't. If you do, you're lucky, but most of us don't. Like, we've graduated. We're kind of on our own. And last but not least, I want to say this. Like, I had this little notes, and it was real cheap. I think I bought it for like $5. But I would write down, like, as I do my questions, if there was a question that I missed, and like sometimes you miss stuff because you misread the question or whatever, which is another conversation. But if I missed something and I really thought it was something else, I would write it down in this book. And that was something that I had to go back to Saunders or like somewhere online or somewhere in an old textbook, or phone a friend or something. That was something that I had to know, like, before I sit for this exam. Whether it showed up or not, I'm going to know this, and I'm not going to forget it, because I really thought that this was I really thought that this is how this was supposed to go, and it wasn't. So, yeah. I had a notebook, and I also, like, I looked over the 35 or 37 pages in my car before the exam. I hooked up this bad boy because the night before, like, I went through and highlighted, like, I overcame a lot of stuff that I wrote in this book, but I went back and I highlighted some stuff that, like, you know, sometime before a test, you got to really look at something. Like, I'm going to look at it. I have photographic memory. I'm going to look at this so I do this, don't slip between the cracks. Like, that's what I did with this book. So, those are the things that I used. I used Hurst, used some of UWorld. I didn't use all of UWorld. I used very little of UWorld because I signed up for UWorld, like, too late. But I did that because I didn't want to take this test and not exhaust all that I could have. Like, I didn't want to not use something and then get an exam, don't pass, and then, like, I feel like crap because it's like, oh my gosh. So, Hurst review. Saunders, yes, only for content that you don't understand, that you just got to go back and look. And also foundations of care and test taking strategies. You have to go in this test would have viewed or listened to or looked up test taking strategies. You have to know test taking strategies, period. Even for things that you know, you still need test taking strategies because of the way these questions are worded and the level of difficulty in some of the questions. You also, let me pick up. 35 or 37 pages is a must. Archer, yes, ma'am. Yes, sir. MK files, you better believe it. And if you don't listen to them MK files, you're going to be sitting in that test and you're going to be like, dang, I should have listened to the Mark Klimek. I should have listened to those Mark Klimek files because he show you so many shortcuts. Like, it's crazy. It's crazy. Like, he'll tell you, for example, let me give you an example. So, everybody wants to memorize, like, signs and symptoms of this, of that, or, like, what the patient looks like on presentation and what can you expect. But, like, for instance, like, for hypoglycemia. So, he teaches you, like, his lessons build on one another. So, like, he might teach you, like, with a shock patient, the patient going into shock, what they look like. And, like, he might talk about alcoholism, and he might teach you about, or, like, try to explain to you, like, not try to explain, but he might mention a random comment about a drunk person. So, when he gets to the diabetic lecture, he talks about, okay, what does a patient with hypoglycemia looks like? And everybody's, like, in the background, like, oh, that kind of stuff. But they weren't really sure. So, if you put a person in shock, their presentation, with a drunk patient, their presentation, if you put those two things together, you have a patient whose sugar is low, hypoglycemia. Like where was he? A drunk person and a shock person together makes a hypoglycemic person. And some of you might know that. Some of you might know, like, all of this stuff memorized. But, like, when you're in NCLEX and your anxiety is high and you just had a question that you know you got wrong and you click to the next question, like, you're just not going to think. But if you think hypoglycemia, drunk and shock, okay, boom. Exactly. So, anyway, anxiety was a big thing. Trying to control your anxiety. Try to, whatever you believe in, whoever your maker is, like, try to tap into them. Try to tap into that network, because if you could tackle anxiety, like, that's half the battle. If you could tackle stress, that's half the battle. A little bit of stress, a little bit of anxiety is healthy. That's a good thing, because we are, like, locked and loaded when our anxiety is so high. So, I mean, not so high, I'll take that back. We are locked and loaded when we have a little bit of anxiety and stress. So, yes, if you are a little anxious, that's fine. But if you are just like, you can't breathe, like you having chest pains, you need to get that under control before you go up in the testing center, so that you can focus on the things that you need to do. Because, like, in nursing school, we've all taken 100+ question tests. This test is going to go by so fast. So just kind of control yourself. It's going to be all right. It's going to be fine. I didn't make this video to scare anybody. Like, I made this video to come and tell you exactly what works for me, because I didn't have that person to come and tell me, like, what they thought about something. Because when you're taking NCLEX, like, we're all searching for someone else's opinion, because we don't want to waste any time. So yes, and there's some people who like to measure themselves up against another person. Throughout nursing school, I was a A-B student. Have I made a C? I haven't even made a C on an exam. Let me make sure I'm right. I think I'm right. Like, in all of my coursework, I have made a A or a B in nursing school. Yeah. An A or a B in nursing school. So, just in case some of you want to measure yourself up to me, I didn't know everything. I don't know everything. But I mean, I studied and I did well on tests. Period. Does that make me a better nurse than anybody? No, because your patients don't even care about that. Like, when you walk in a patient's room, they're not going to say, oh, how many questions did you have on NCLEX before it shut off? Like, no one's going to care. So take your time, trust in yourself, believe in yourself, focus on the question, read the question twice, try to answer the question before you look at the answer choices. And for select all that apply, treat them like true and false. Treat them like true and false. And never, like, don't fall for, oh, I'm gonna just select the extra one just to be on the safe side, because that is not a good idea. So oh Lord, this video is so long, but I just want to say thank you for watching, thank you for tuning in, and hopefully, you know, my goal is to help somebody. My goal is to put this information out there and actually help somebody, because you've come too far. You've made it through nursing school. You've come too far to allow NCLEX to take over you. We just made it too far. Like, we've been through too much clinicals and everything. Like, we've been through too much to allow NCLEX to defeat us. Like, nah, that's not happening. I believe in all of you. You need to believe in yourself, and you'll be fine. And I wish all of you the best of luck on NCLEX and your future as a nurse. Goodbye.